How has injury risk assessment evolved for athletes? Imagine a time when injury prevention was mostly guesswork, based on just watching athletes and noting obvious issues. Now, it's a whole different story. Injury risk assessment has changed a lot over the years. It used to focus on simple risk factors like past injuries or poor equipment. But today, it considers many more things. It looks at how physical, mental, and environmental factors all work together to influence injury chances. In the early days, trainers mainly looked at injury history and training mistakes. If an athlete had a previous injury, they were seen as more likely to get hurt again. Equipment and training volume were also checked. But these assessments didn't account for how stress, fatigue, or psychological state could affect injury risk. Then came the stress capacity model. This model says injuries happen when external stressors like training load or competition pressure exceed an athlete's internal capacity to handle them. It emphasizes balancing workload with recovery. This idea helped shift focus from just external factors to also include internal ones. As understanding grew, models became more complex. The sequence of prevention model introduced a cycle: find injury problems, understand their causes, implement prevention strategies, and check if they work. This approach made injury prevention more systematic. Behavior-oriented models added psychological and social factors into the mix. They recognized that an athlete's mindset, stress levels, and environment all influence injury risk. For example, high stress can impair coordination and decision-making, leading to injuries. The most recent approach is the complex systems view. It sees injuries as the result of many interacting factors. Instead of looking at one thing, it considers how physical condition, mental health, equipment, and even environmental conditions all connect. This helps trainers develop more personalized injury prevention plans. Today, injury risk assessment also includes monitoring training loads carefully. Using wearable devices, coaches can track how much athletes are doing and adjust accordingly. They also look at psychological health, encouraging athletes to communicate stress or discomfort early. Preventive exercises like strength training, flexibility work, and proper equipment use are now standard. For example, ankle braces and balance exercises are common to prevent ankle injuries. In training, coaches now combine these models into daily routines. They keep a close eye on how athletes feel physically and mentally. Adjusting training intensity and recovery times based on individual needs helps reduce injury chances. Creating a supportive environment where athletes feel comfortable sharing concerns is also key. This way, potential issues are caught early, keeping athletes safer and healthier. In short, injury risk assessment has grown from simple checklists to a detailed, multi-layered process. It now helps athletes stay healthy, perform better, and recover faster when injuries do happen.